Welcome back to Fox 51 Today. Sometimes you should know this, getting your kids to go to bed, go to sleep, hard enough as it is.
It is.
But imagine if they had a sleepwalking problem. It can make that even worse.
That'd be rough.
That would be very rough. Dr. R.V. Ghuge with the Sleep Medicine Institute of Texas is here to explain a little bit more about this. Good morning.
Good morning, Rachel.
Morning.
Good morning, Robert.
Hello.
Well, now, sleepwalking in kids, I mean, that's very interesting. Is this just a stage that kids go through during their childhood, or is this a disorder?
Believe it or not, sleepwalking is actually a sleep disorder. You know, sleep is a very complex, active process. It's a very integrated neurocognitive function that the brain performs for itself. There are many things that the brain does during sleep, but there are three states of beings, of all human beings. One is, of course, we know as awake, and we always thought the other one was sleep. But you would be a little bit off if you just thought that. It's actually REM sleep and non-REM sleep. They're as different from each other as they are from wake. And non-REM sleep is where you see sleepwalking.
And REM being the deeper sleep, right? That's when folks are, I guess, in deeper sleep.
Yes, absolutely.
So with kids doing that now, obviously there could be some issues with that. Certainly if they were to get out of the house, I mean, that could be one. What else do you, I mean, there's, well, how is it treated? We'll steer away from maybe some of that. Are there treatments for it?
Certainly, Robert, there are so many concerns with sleepwalking. Primarily, sleepwalking is a disorder that starts when you go from a conversion of deep non-REM sleep into lighter sleep or transient wake. So as you're coming out of this deep non-REM sleep, it's about 60 to 90 minutes after you fall asleep, the brain can enter into a dissociative state, a state where you have partial sleep and partial wake. And so in this particular bizarre situation, the child or even an adult can manifest several forms of parasomnia, as we call them. And some can be just confusional arousals where they wake up, they go back to sleep. Some can be where the child is inconsolable. Even as young as a year or 2-year-old babies may just crawl in the crib and fall asleep at a different place in the crib. Older children might wake up or seem to be waking up, and without their knowledge, they just walk into the parents' bedroom and crawl into bed, or they are found asleep in odd places like the kitchen floor or their bathroom, or they may just get up, go to the bathroom and try to, pee, and but they're not doing it in the bathroom, and come back and go to sleep again. The concern with sleepwalking truly is that there are other conditions that mimic sleepwalking: seizure disorder, movement disorders during sleep. There are many other sleep disorders that actually cause sleepwalking to start, like sleep apnea, REM sleep behavior, periodic limb movements of sleep. So one can treat sleepwalking if you can identify the source, the cause, or if it is being mimicked by seizures, you can fix the seizures. So it's very important to evaluate the child to find out if it is just benign sleepwalking that is natural, or is it secondary to something else. Clearly, there is a genetic predilection. So in most of these children, there is a 60% likelihood of a family member having sleepwalking.
Well, that is very interesting. Now, unfortunately, we've run out of time, but if we do want to find out more information about childhood sleepwalking, maybe we think our child has this, sleeptyler.com, would that be a good place to go?
Absolutely. Okay. And they can definitely come and see us.
All right. Well, thank you so much for stopping by this morning, Doctor.
Thank you very much.
Coming up on